Thanks a lot. So yes, thanks a lot for the nice transition. So I'm Marie-Claude Robert, I'm from Nestlé, so this is my disclosure. I'm a Nestlé research employee. And as you see on the slide, I showed you different precautionary allergen labeling examples. This is definitely what consumers do not want to see anymore. They want to see something that is more harmonized and that is makes more sense to them. And I think everyone agrees that we have all to go in that direction and harmonize the meaning of precautionary allergen labeling as well as the message that we want to make to the consumers. So I cannot talk about precautionary allergen labeling without mentioning what allergens we need to label, so I'll also discuss that part. And then I'll go into more details about what precautionary allergen labeling means what is the risk assessment methodology that is expected to be used, what are the action levels that are expected, and Sabine just mentioned it. There are lots of discussion which are the levels that which are the level of the sensitive population that need to be protected by mentioning the allergens on prepackaged food products, and how to communicate this to the patient. And for me, especially also, what is extremely important is how to communicate this change if ever we are going to change the levels that would lead to precautionary allergen labeling. Of course, then I will talk about challenges and conclude. But before all this, I have to mention Codex Alimentarius. For those who are not familiar with Codex Alimentarius, this is an entity that was established already in 1963. It was established jointly by the Food and Agriculture Organization and the World Health Organization. And especially, I need to mention the mission of the Codex Alimentarius. It is to protect consumer health and promote fair practices in the food trade by setting international science-based food safety and quality standards. So you fully understand that allergen management and especially allergen labeling is fully in the remit of the Codex Alimentarius. So this is an entity that is made of 190 member countries, so one member organization, which is the European Union. So every country has a seat there and they can vote and agree on the standards that will be set. And as Sabine mentioned, there are also intergovernmental and international non-governmental organizations that are part of Codex. They are observers at Codex, but can comment and share knowledge. So industry association, but also patients organization are part of this entity and can comment and make advance in this progress. Specifically, we participate in the Codex Committee for Food Labeling, so this is CCFL, that is now discussing the whole labeling part for allergens. And in 2020, there has been a lot of progress done because CCFL, so the Codex Committee, wanted to review the standard for labeling of the prepackaged food. And in doing so, they reviewed the whole list, or they organized that scientific committee reviews the whole list of food allergens that need to be labeled and make sense to sensitive people. So these scientists, they reviewed scientific literature and determined which are the allergens that need to be managed and seen as priority global food allergens. But they also determined that there are few allergens that need regional management and regional assessment. So you see in this list, it's maybe quite tiny, the overall global regulations that are in place. So on the left-hand side, you have what was determined in 1999, I think, by Codex the first time. And now with this revision, that is will be agreed, I hope, in 2027. Normally, so we shall come to a more harmonized list of food allergen, especially what I like is the tree nuts that have been listed and clearly listed, and we know which are the tree nuts that need management, which are the ones that are more regionally affecting people. And also more especially with this study, we can see that now sesame was introduced as a global priority allergen, and you see this is missing in many national regulations. So if this standard is agreed by 2027, it will mean that all national regulation will also need to be updated accordingly. So this ensures also harmonization of the labeling and ensures that people, when they travel, they will also get the information whether the allergen is present, intentionally present, but also present by cross-contact. So this is for the labeling part. Now I move to precautionary allergen labeling, and an important topic with precautionary allergen labeling that has newly now also been addressed at Codex is the risk assessment methodology, And I think everyone now agrees, since there has been this consultation work done by experts, that precautionary allergen labeling should be based on the findings of risk assessment and not be done by so I'm not touching anything anymore. So the decision to use PL, yes, should be based on a risk assessment. That's the first step forward. But the risk assessment, it was also a lot of discussion whether this would be limited to qualitative risk assessment. And no, everyone agrees now that it should also include, wherever possible, quantitative risk assessment. And yeah, so I have an example of this just to make you understand how this works. I just built a fake recipe of a cookie recipe, and that means for food business operators that they need to get accurate information from their raw material vendors. So if I here take the example, if we take a cookie recipe with flour, chocolate, and sugar, very simple recipe, in the flour, as a food business operator, we need to know exactly, of course, what is the ingredient in the flour, but also what cross-contact might be present in the flour, but also what are the maximum level of cross-contact when the cross-contact are homogeneous. But also, and this might also be further discussed, I've seen publication where they also want now to assess in homogeneous cross-contact, so piece-form cross-contact, to also assess this quantitatively where possible. So this is a real challenge now to the raw material vendors to understand and to measure and to know their own ingredient perfectly, so to tell food business operator which are the cross-contact present. So as a food business operator, you take all this data and you have to process it to understand in your finished product recipe how much cross-contact will be there. So this builds your allergen profile of your finished product. Of course, as we are food business operators, we often use shared lines, so you also have to do your homework and determine whether you can clean your line, how much is your cleaning efficient, and if it is efficient, how much of the allergen cross-contact remains on your line after line cleaning, and take this into account for establishing the allergen profile of your finished product. So once this is done, you are not even halfway of determining what's the finished product label, but you are on the good way. Now the second step that is still being discussed today at Codex Alimentarius are the action levels that will determine whether you go for precautionary allergen labeling or not. And this depends a lot on the reference amount. So up to now, we were rather in the industry using the reference dose that was protecting 99% of the population. I will show you a graph that explains better what this means. And now the proposal of Codex is to move to reference doses that will protect 95% of the population. What I want to show here is the figures are of course quite different, but also just mention that, as you see, for cereals containing gluten, we are still missing some data. So this will be work ongoing at Codex Alimentarius. So the expert group will also come up with a reference dose or a proposal how to manage not only wheat, but barley and rye also. There is, I must also mention this, there is still a lot of discussion whether precautionary allergen labeling shall be mandatory when you exceed a certain threshold. So whether it's only when you exceed the certain threshold or whether it's mandatory by when you exceed the certain threshold, and if it can still be voluntary below that threshold or not. So these are really important discussions that are ongoing now. So just to make it more visual, what it means when we change the reference dose, how much of the population is protected or not. So you see, in the past industry, I would say the recommendation was to use the threshold that would protect 99% of the population, means 0.4 in 1,000 people were at risk of experiencing anaphylaxis. Now the proposal is to move to 95, to a threshold that would protect 95% of the population, and that means 2.4 out of thousands are at risk of experiencing anaphylaxis. So this is the background of the discussion. But again, now I want to show you what this means in reality. So if we still keep my example, here I do not mention the allergens that are present as ingredient, but only the cross-contact that we calculated, which can be present in this cookie, fake cookie. And if I take the reference doses just for these cross-contacts, then I also have to take into account reference amounts. So these are amounts of food that are calculated or that are determined within the population. And here I took a reference for cookie out of a publication. So the P50 value is the amount of cookie, here 20.7 gram, that is, will be the maximum amount that is eaten by 50% of the population that is assessed. So 50% of the population will eat in one eating occasion 20.7 gram of a cookie or less. So you protect this population by calculating your limit based on this value. There are also other voices that are raised and that discuss P75 value of food consumption data. So this value would protect 75% of the population, or takes into account what amount of food 75% of the population is eating. And here you see with the example, we move up to 36.1 gram of cookie. And if we again calculate the limit, so the limit is equal to the reference dose, so either based on EDO1 or EDO5 figures, divided by the reference amount, so either P50 or P75 values. And on the bottom, you have all results. And you see now what is recommended by Codex is to use EDO5 values and P50 data, food consumption data. I'll come back to the end point, which is communication to consumers. And here it's really good because I think at Codex everyone more or less agreed, but I think that, yes, this will go like this. Everyone agrees that we need a simple wording to communicate potential risk to consumer. It shall be clearly contrast from the surrounding text, and it shall also be listed just below the ingredient listing, so to be found easily by consumer when taking a prepackaged food in their hands. So this wording may contain and the allergen. at international level. So again, if I take my example, so now we have the allergen profile of the food, and we have now different limits. And if we see in red, this is the limit that was used, let's say, up to now by a majority of food industry, or that this limit was the one that was recommended to be used. And now we have this new limit that is the one that is discussed currently at Codex level. And we see that the difference is quite obvious. With the same food, if I assess it against the strictest limit, it means we, of course, label the ingredient, milk and wheat, but then all the cross-contact that I fakely determined in that food, they will be labeled as PEL. If we switch to the new limit as proposed by Codex, we only label the ingredient. The food is exactly the same, but the labeling will be quite different. So it means what are the challenges and which are the conclusions? So for me, clearly, the challenges and all orange boxes, these are challenges that are known and that will be further discussed at Codex. So for me, the challenges is, of course, to agree and harmonize globally on action levels and the reference doses, to agree to have an international system where consumer can understand what is labeled and what will not be labeled, and also travel safely and eat food safely. The second challenge is to have harmonized reference amounts, because else you will have, again, different labelings depending in which country you are seated or in which country the food will be sold. And this is also, again, for me, not a progress to consumer, because labeling should really make sense to the consumer and not to the individual country. Again, also, as you have seen, the work for the food business operators is really important, because you have to calculate a lot. You have to understand what your vendor is doing, how sure he can be that he can provide you with the food that has maybe no cross-contamination or a little bit, and to which level then. So there needs to be also one system that ensures that small and medium enterprises, they are onboarded in that system, and also developing countries, because we cannot afford having different labels in different countries. As I before mentioned, the communication to food-sensitive consumer, it is also a very important part, because as I showed you, the same food, now depending on which system you assess it, will have different labeling. So when there will be this switch in the system for determining by when you go for precautionary allergen labeling or not, this shall clearly be communicated to consumers, because else they will find that a new product has no PEL anymore. They will think, oh, they did well, they now cleaned everything in their line, everything in their raw material, and might go for it without understanding that the system, the risk assessment system, changed. And for me, then, it's also very important that we switch system if ever that if ever Codex decided to go in that direction, and other regions or countries, that everyone switches at the same pace. Because if there is only one country that makes the switch, it will be very difficult for consumers to understand why the labeling in that country is different with the same product than in another country. Of course, I addressed this. The Codex Alimentarius has also to work on a reference dose for gluten-containing cereals. That will be an ongoing work. A very important point that also Claire knows well is the kit manufacturers, so those working at the methods for detecting allergens, so to check that your line cleaning is well done, they should work on harmonizing the reporting units, because this is today really a nightmare for anyone to understand what we are measuring. Is it the whole food? Is it proteins? And really risk assessment is done in protein units. the kit manufacturer, they have to do their homework and now switch to protein units. The one challenge will also be to understand what sensitive consumer will be doing if ever we switch to ED05 reference values. Maybe we will need specific labeling, specific claims to also give them food choice. And I hope with that we can really restore consumer trust in PEL. And then this is my final message. Oh, clicking 3 times, not moving. Yeah, I really hope, because I'm working since 15 years in food allergens, I really hope that now there are still few details to be set up and harmonized, and really harmonization is my main word. I really hope that with this whole work that really people, they can trust PEL. And I mean, we are working hard so that people can trust PEL. It has really to be meaningful to these sensitive consumers. So thanks a lot for your attention.
Thank you, Marie-Claude, for this really great overview, what is going on, and we clearly have some work to do, but when we do it together, I hope we will get there. Thank you very much. We take questions later, yeah,